Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Hepatitis. Introduction. Hepatitis is an inflammation or swelling of the liver. It can cause liver pain. Hepatitis can lead to a type of scarring called cirrhosis. It could also lead to cancer. Viruses cause most cases of hepatitis, but there are other causes as well. You can help prevent some viral forms of the illness if you get a vaccine. Hepatitis sometimes goes away by itself. If it does not go away, it can be treated with drugs. Sometimes hepatitis lasts a lifetime. This program explains hepatitis and its causes. It includes information about the symptoms, treatment, and prevention of hepatitis. The liver. The liver is an important organ of the body. It is located in the upper right part of the abdomen. It plays several roles in the body. The liver processes fat, sugar, protein, and vitamins that the rest of the body uses to stay healthy. The liver also makes bile, a yellow liquid that helps absorb the food we eat. Bile is made out of a substance called bilirubin, a yellowish chemical. The liver helps protect the body by getting rid of harmful substances called toxins. This happens before they have a chance to poison the body. What is hepatitis? Hepatitis is inflammation or swelling of the liver. When the liver swells, it stops working well. Hepatitis can lead to scarring of the liver. This is known as cirrhosis. In some cases, hepatitis also can lead to cancer. Viruses cause most cases of hepatitis. The type of hepatitis is named for the virus that causes it. Hepatitis A, B, C, D, and E are named for the viruses they are caused by. Examples of other viruses that can cause hepatitis include cytomegalovirus, Epstein-Barr virus. Hepatitis could be caused by drug or alcohol use. It could also happen if your body attacks its own tissues by mistake. Some people who have hepatitis have no symptoms. Others may have loss of appetite, nausea and vomiting, diarrhea, dark-colored urine and pale stool, stomach pain, jaundice. Sometimes it goes away by itself. If it does not go away, it can be treated with drugs. Sometimes hepatitis lasts a lifetime. You can help prevent some viral forms of the illness if you get a vaccine.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Hepatitis A. Hepatitis A is caused by the Hepatitis A virus, also known as HAV. Hepatitis A is spread through contaminated food or water. Food or water could be unsafe if it comes into contact with feces from an infected person. It rarely spreads through contact with infected blood.
People most likely to get hepatitis A are people who travel to other countries, people who live with or have sex with an infected person, men who have sex with men, people living in areas where children do not receive the hepatitis A vaccine, daycare children and staff, drug users.
People can prevent hepatitis A. There is a vaccine that protects adults and children older than age 1. Immune globulin can protect you from hepatitis A for a short time. It is given before or within 2 weeks of when you come into contact with the virus. Immune globulin is a type of protein. It helps the body fight infections. You can lower your risk when you travel to another country. To prevent infection, do not drink tap water. Practice good hygiene and sanitation. Hepatitis B and D. Hepatitis B is caused by the hepatitis B virus, also known as HBV. The virus that causes hepatitis D is called delta agent or HDV. Hepatitis D can only happen in people that already have hepatitis B. Hepatitis B is spread through infected blood. It could spread through sex with an infected person. It could be passed from mother to child during childbirth.
People most likely to get hepatitis B are people who live with or have sexual contact with an infected person, people who have multiple sex partners, men who have sex with men, injection drug users, people from areas with high rates of hepatitis B, infants born to infected mothers, healthcare workers, hemodialysis patients, people who travel outside of their country.
People who received a transfusion of blood before 1987 had a higher risk of infection. Better tests to screen blood donors were created in 1987. The hepatitis B vaccine is the best way to protect yourself. Do not share items such as toothbrushes, razors, and nail clippers with a person infected with hepatitis B. Use latex condoms to lower the risk. Do not share drug needles. Hepatitis B can be treated with antiviral medications. These are drugs that are used to slow the spread of the virus. They also boost the immune system. A baby born to an infected mother should take hepatitis B immune globulin within 12 hours of birth. The baby should also get the hepatitis B vaccine. This can help prevent infection. A person with acute hepatitis B is not often treated with antiviral drugs. The disease may go away on its own. Most people with acute infection become well by the time they are young adults. An infected baby is most likely to develop chronic hepatitis B. Hepatitis D could happen at the same time as hepatitis B. It could also happen in people who already have hepatitis B. A person infected with hepatitis B is at risk for hepatitis D. Injection drug users have the most risk. Hepatitis D can be treated with drugs. They are used to slow the spread. The illness can be prevented by getting the hepatitis B vaccine. Hepatitis C. Hepatitis C is spread through contact with infected blood. It could spread through sex with an infected person. It could be passed from mother to child during childbirth.
People most likely to be exposed to the hepatitis C virus are injection drug users, people who have sex with an infected person, people who have multiple sex partners, people infected with HIV, healthcare workers, infants born to women who have hepatitis C, hemodialysis patients.
People who had a transfusion of blood before July 1992 were also at a higher risk. So are people who have received clotting factors made before 1987.
There is no vaccine for hepatitis C. The only way to prevent the disease is to reduce the risk of contact with the virus. Certain medications can treat and cure hepatitis C, but they can be expensive.
Hepatitis E. Hepatitis E is spread through food or water. The food or water is unsafe if it comes into contact with feces from an infected person. This disease is rare in countries where there are laws for safe handling of food and water and sanitation. People most likely to be exposed to the hepatitis E virus are people who live with or have sex with an infected person, people living in areas where hepatitis E outbreaks are common, people who travel to other countries.
There is no vaccine for hepatitis E. The only way to prevent it is to avoid contact with the virus. Do not drink tap water when traveling to other countries. Practice good hygiene and sanitation.
Hepatitis E usually goes away on its own. It could last for a few weeks or months. The infection does not require treatment to clear. Other types of hepatitis. Some cases of viral hepatitis are not caused by hepatitis A, B, C, D, or E viruses. These cases are called non-A through E hepatitis. Toxic hepatitis causes the liver to become inflamed and swell. It can be caused by chemicals used in cleaning solvents and manufacturing. It can also be caused by alcohol or drugs. Over-the-counter pain relievers and some prescription drugs could cause it. Drugs that can cause hepatitis include aspirin, acetaminophen like Tylenol, ibuprofen like Advil, naproxen like Aleve, valproic acid, niacin, certain antibiotics and antiviral medications, anabolic steroids. If you take these drugs often, it can hurt the liver and cause inflammation or swelling. Alcoholic hepatitis is caused by drinking alcohol. It is a type of toxic hepatitis. Not all heavy drinkers get it. Some people who only drink moderately can get it. The only way to prevent it from getting worse is to quit drinking alcohol. Drugs can help reduce the swelling of the liver. Toxic hepatitis can be treated if you avoid the toxin. Some drugs can reverse liver damage caused by acetaminophen. Patients may also be treated in a healthcare facility. They can receive care to treat nausea and vomiting. They may have fluids replaced. A liver transplant may be the only way to cure severe hepatitis. The damaged liver is taken out through surgery. A healthy liver from a donor is placed in the body. Healthy livers are rarely given to people with a history of alcohol abuse or dependency. There are not enough livers for transplant to help every person that needs one. Patients waiting for a liver transplant must follow strict rules. They cannot drink alcohol for 6 months before the transplant. They must not drink alcohol ever again after the transplant. Autoimmune hepatitis is another type of hepatitis. It causes the body's immune system to attack liver cells. The immune system normally protects the body from infections. This disease makes the immune system attack the body instead. This causes the liver to become inflamed. The cause of autoimmune hepatitis is not known. Some diseases, toxins, and drugs may cause it. It is treated using the same methods as other types of autoimmune diseases.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Hepatitis is an inflammation or swelling of the liver that makes it stop working well. It can lead to scarring, called cirrhosis, or to cancer. Your liver helps your body digest food, store energy, and remove poisons. Viruses cause most cases of hepatitis. The type of hepatitis is named for the virus that causes it. For example, Hepatitis A, Hepatitis B, or Hepatitis C. Drug or alcohol use can also lead to hepatitis. In other cases, your body mistakenly attacks its own tissues. Some people who have hepatitis have no symptoms. Others may have loss of appetite, nausea and vomiting, diarrhea, dark-colored urine and pale bowel movements, stomach pain, jaundice, yellowing of skin and eyes. Treatment for hepatitis varies depending on the type of hepatitis you have. Sometimes hepatitis goes away by itself. If it does not, it can be treated with drugs. Sometimes hepatitis lasts a lifetime. Most forms of hepatitis can be prevented by practicing good hygiene and safe sex. You can help prevent some viral forms by getting a vaccine. Talk to your healthcare provider to learn more about getting vaccinated against viral hepatitis.
Thank you for using Explain.